So most people have a financial plan of some sort in order. You probably do. Most people have their insurance needs covered to a degree. Many people even have their wills and estate planning done, and I hope you do. But does anyone have a health plan? Do you have one? Do you even know what I'm talking about? Today, I want to talk really quickly here about something that nearly nobody's talking about or knows about, and that is the gap between the service you get in the hospital versus what you could receive. Now, I'm mostly going to be talking about Alberta, the jurisdiction I live in, but it would be very similar across all of Canada and in many jurisdictions in the U.S. as well, and probably in the world. So first, I'm just presenting some educational material for you to consider. I'm not giving you medical advice, and if you're in distress with any of the health conditions I may mention, please seek medical attention. So when I went through my health challenges a number of years ago, the traditional medical system here in Alberta, where I live, they did me no favors. I was misdiagnosed, given unnecessary, ineffective treatments, and I wasted nearly 2 years of my health. I eventually had to take matters into my own hands, do my own research, and find alternatives that worked for me, and that's what healed me. It's because of this experience that I dug in and I found the flaws in the system. But I want to be perfectly clear. First off, doctors and nurses and those in the medical system, they have the best intentions. They usually got into their professions because they're truly wanting to help people, and they are worthy of our recognition for sure. However, for a variety of reasons, including the influence of big pharma, poor policy, the standard of care in Alberta and like I said, many jurisdictions is limited and does not include many treatment modalities that are the standard of care in other places around the world. Many of these modalities are proven, have a ton of research. They've been around for a long time, some for thousands of years, and at free or even a very low cost. Many doctors, won't even know about these because they've not been taught about them. Again, the medical school curriculum is heavily influenced, for sure. Most continuing education for health professionals put on by industry is not truly independent. Back when I was, a practicing accountant, we could just go to some company's workshop on their newest product or their newest service or whatever, and we could cover off our professional development credits. And I know it's like that in many other industries as well. It's no different for doctors. Many doctors over a certain age won't even know about the latest science of the last 10, 15, 20 years. General practitioners, they need to know a lot. And specialists need to know, very deep, but not very wide. The medical system is not designed to work. The medical system is designed to work in silos and not look at a person's health holistically. All facets of it. Many doctors still believe that cholesterol causes heart disease. I've even had an old school doctor tell me that they should be putting statins in the drinking water. It takes on average 15 to 20 years for a proven, well-researched, peer-reviewed studies to become the standard of care to the frontline health worker. For drugs, it takes an average of 12 years to go from the lab to a patient. So even if your doctor or specialist knows about this new research, knows about these new modalities, even if they believe in the efficacy of it, if it is not classified as the standard of care, they cannot tell you about it. They will get in trouble. They will be sanctioned. They may risk their livelihood and financial situation. And we're certainly seeing a lot of that right now, for sure. Now, this is a U.S. stat, but doctors spend $210 billion a year on procedures that aren't based on the patient's need, but out of fear of liability. 210 billion. Just think about that for a second. There are many things that doctors will do or not do for their own families, but they can't tell you about it. I have a family member in the medical field, and who's told me privately, about the misinformation they see, but they cannot speak out for fear of risking their license and their very comfortable income, to be frank. So it's up to you to know what is available to you, what to ask for, how to access these resources, and how best to provide world-class, scientifically proven treatments and modalities for yourself and your family. So let me give you an example here. So a couple of years back, my nephew unfortunately had 4 TBIs, traumatic brain injuries, occur in a 4-month period. Uh, it dramatically affected his personality. Luckily, that old notion of sit in a dark room, for a period of time, luckily that's dead and gone. The advice he did get was to try and sleep better, stay off devices, or at least limit their use, and do some breath work and mindfulness type of work. So those are all great and good first steps. But there was so much more that could have been done, especially around nutrition, supplementation, and auditory stimulus. I wish his parents knew the proper steps to take, or had reached out to me at the time. But luckily, he seems to be fully recovered. Here's another example. Many people who have heart disease or even erectile dysfunction will be familiar with taking nitroglycerin or nitro, which is a vasodilator, which meaning it opens up the blood vessels to alleviate symptoms. If you're having a heart attack, great stuff to have around. But you won't be told about the dietary foods rich in nitrates and nitrates that convert into nitric oxide and also help dilute the blood vessels and even lower your blood pressure. You can incorporate these foods into your diet to help your conditions. And even if you were told about these food sources, you certainly wouldn't be taught about breathing techniques to boost your own endogenous production of nitric oxide, 15-fold in some cases, to not only help vasodilate the blood vessels, but also act as your body's own defense mechanism against pathogens of all sorts. That might be kind of useful right about now as well, right? So moving on to another topic. I've been very open about this. I have Alzheimer's disease in my family. I have tested myself, and I have that one variant of the Alzheimer's gene that makes me slightly more likely to develop it. So, and as I mentioned, I have members in my family who have it and passed away of Alzheimer's as well. So if you or a loved one are starting to show the early signs, do you know what to do or how to battle it, or even how to reverse Alzheimer's? There are at least 10 different modalities to battling conditions like Alzheimer's, but you'd be hard pressed to get this information from the medical system. And even if you did all the research on your own, like I have, do you know where to source all these types of treatments? So let's take a step back for a second and let me be perfectly clear. Prevention is always the best course of action. Being proactive rather than reactive will always be in your best interest and the best investment in yourself. Diseases, conditions, ailments, they don't just afflict us one day. They're the tiny little paper cuts that over the course of years and years finally catch up to us. So being proactive is the single best thing you can do for you and your family's health. Optimizing lifestyle choices is the number one thing that I work on with my clients for their health, performance, and longevity. Even if there should be a tragic accident, like a car accident, something that you obviously can't prepare for, there's certainly knowledge to be equipped with it, how to optimize recovery. Let's talk about the mouth for a second here. I'm guessing we've all been to the dentist before. I'm sure we've all taken our kids there as well. We've all had them, put that fluoride paste on our teeth, and we've all been recommended to use fluoride toothpaste. We've been told that we need fluoride to kill that bad bacteria in our mouth. Now, this is true. It does kill the bad bacteria, but it kills all bacteria, all microorganisms. I'm sure we've all heard by now that the microbiome, the good and bad organisms in our stomach and digestive tract, dictate so much about our health. You may have even heard about the skin biome and how that affects our health. Well, we also have a mouth microbiome as well. When you use fluoride and mouthwash, etc., you're killing everything in your mouth, all your mouth microbiome, both bad and good. Not only does this affect your gut microbiome, but actually potentially makes you more susceptible to issues with your teeth. You can get a coating on your teeth that doesn't actually allow to clean deeply enough. Not to mention that fluoride is a known neurotoxin in large quantities. So even if they knew, dentists cannot tell you about how your child's breathing properly through their nose rather than through their mouth promotes proper jaw and mouth alignment, which allows adequate room for the teeth to come in and lessens the likelihood for needing braces and other treatments. There are alternatives to much of what we believe when it comes to dentistry. One just needs to know. So I kind of alluded to it, but one service that I offer to my masterclass clients, beyond optimizing their lifestyles, to help them build a health plan, and that's really what I'm talking about here today. A playbook, so to speak, so that you know what to do, you know what to ask your doctors, what resources are available to you, where to source the resources for a number of any potential afflictions that may occur. For my clients, this is all about knowledge and empowering themselves to be prepared for the worst. You can think of this as another form of an insurance policy for you and your family's health. Typically you would add this playbook and keep it with your personal directives, as well as discuss it and keep a copy for your power of attorney as well. Now, to be clear, this is a separate document. It's not legally binding. It's not part of your will or anything like that. But it needs to be available for review if something should happen to you or a family member. Again, this is a service that I offer to my masterclass clients that I am now offering as a standalone product that could be implemented outside of my masterclass. And again, my masterclass is called Build Your Personal Blue Zone. Now, let me very briefly describe what the process would look like. First I'd go through, we would go through a 15 or 20 minute, no obligation call to discuss any issues that you may already be facing, the things you're concerned about, the things that are keeping you up at night, the things, in your family history, etc. And the next step would be, if during that call or sometime afterwards you decide you want to be absolutely prepared to protect you and your family's health, I'd send a health history form, an intake form, if you will, to fill out, and then we'll together work on building out this playbook that is customized to you and your family's individual situation. Again, this is the first time offering this as a standalone service outside of my personal Build Your Personal Blue Zone masterclass. Of course, many of the action steps would be very similar for everyone. A lot of things would be standardized, but again, there's a lot of nuance sometimes that comes in, and that sometimes makes all the difference to you. And the best part is that as new treatments and modalities become available, or as the standard of care changes, you will receive updates to incorporate and update your plan. Let me give you a recent example of a change here in Alberta. So most of you are probably familiar with ozone or O3. You may know that it's harmful for your lungs if you breathe it in. You may also know that it's used in medical settings for disinfecting equipment and services. But do you know about ozone therapy? Which can have the following benefits: inactivating bacteria, viruses, fungi, parasites, yeast, etc., stimulating the immune system to speed up healing, improving circulation by cleaning the arteries and veins, purifying blood and the lymph, normalizing hormone and enzyme production, having anti-inflammatory properties, reducing pain, stopping bleeding, preventing shock, limiting stroke damage. These all sound pretty good, right? Especially for this thing that's been hanging over our heads for the last 10 months or so. Ozone therapy is not the standard of care here in Alberta or in many jurisdictions. After researching and learning about it in other jurisdictions, 2 years ago I started looking for private clinics that may offer it. I couldn't find any. Recently, my interest was piqued again, so I looked into it and was pleasantly surprised. There are now a few private clinics that offer ozone therapy, so that's a great start. At the same time, I found a company that has found a way to capsulize ozonides, which is what the ozone breaks down into our body. So I'm just beginning to experiment with that product right now, and I'll have a post about that in the future as well. And finally, about 4 weeks ago, I came across a company in Calgary, which is kind of sort of where I live, that's on the verge of being able to start testing nebulized ozone, which essentially means you can put on a typical oxygen mask and breathe in an ozone water mist that won't be harmful to your lungs and that can kill pathogens in the nasal cavity and the upper respiratory tract. So that sounds pretty promising, and more details to come in the future. I'm really keeping my eye on that company. So that's just one example of many. Where there's a gap between the gold standard of treatment and the standard of care in Alberta or in other jurisdictions. In many places, this gap is being filled by private clinics and companies. But there again, there's also very much that you can do that's free or very little cost. You just need to educate yourself. Lastly, let me talk one last example here. Cancer. Definitely the trickiest one to discuss. And while there's some really, really interesting drug treatment options being developed, they're probably a couple of years off. The current options almost always entail one of three options: surgery, chemo, or radiation, and they each have their drawbacks. Now, getting a diagnosis is a very difficult conversation to have, but do you know the questions that you should be asking your oncologist? They will more than likely not discuss nutrition or lifestyle choices, nor alternative treatments. Now, don't get me wrong. I'm not suggesting you don't follow their recommendations, but there are things you can do alongside on your own that they won't tell you about because either they don't know about them or they can't tell you about them. So, do you know how to source these alternative treatments or what steps you can take personally? Again, private clinics are filling some of the gap here in Alberta, but not all the way through. So, one final thought again, as I mentioned earlier, prevention is your best tactic. Should you be suffering from one of many of these ailments we already discussed, or others as well. But if you should be inflicted with one of those, please seek medical attention and use these modalities as an adjunct on the side. Now, if you're truly interested in protecting your and your family's health, you need to think about implementing a health plan. Contact me directly and we can talk about it. So again, you can reach me at deepaksainihealth.com or personalbluezones.com and we can build this plan together. So that's just what I wanted to share with you all today, and I really hope you seriously think about building this health plan for yourself. Thank you. Cheers.